You are about to listen to the Dr. Dahlia Show. Sassy, stimulating talk radio. And now, here's Dr. Dahlia.
Doctor, tell me true. What's a heart like mine supposed to do?
All right, we are back on the Dr. Dahlia Show. 1-877-Dr. Dahlia, 1-877-DOCDALI. So in my neck of the woods, it looks like we have a doctor accused of running a $95 million scheme to defraud Medicare. I think the cases of fraud are going to just keep coming and keep. I mean, now that we have a task force under J.D. Vance and Dr. Oz, who's in the RFK Jr. and under the Trump administration looking for this, I think we're going to see a lot of these cases finally exposed. But this is an alleged case involving somebody, I believe, in my neck of the woods. A grand jury indicted Dr. Stephen Dubin, 74 years old, for allegedly billing for medically unnecessary amniotic wound allografts applied to elderly Medicare patients. This is according to the U.S. Attorney's Office for Nevada. They say this is being reported by News 3, that this indictment exposes a scheme driven by greed, not medicine. As alleged, this provider exploited elderly patients by pushing costly and unnecessary medical procedures, then lied to Medicare to pocket millions of taxpayer dollars. That's according to Assistant Attorney General Colin M. McDonald of the Justice Department's National Fund Endorsement Division. Prosecutors allege the doctor received other illegal kickbacks, bribes, and rebates from two different allograft distributors, while Medicare paid over $54 million. I'm blown away by this, because as a physician who billed Medicare, trying to get Medicare to pay me for just a simple visit of a patient I'm seeing for blood pressure, or a simple urine test, or a flu shot, was like pulling teeth. Remember, I could only get 12 cents for a flu shot I gave with Medicare? And I'm looking at these people. They figure out the vulnerabilities. And unfortunately, I'm just trying to give good care to a Medicare patient, and I'm barely getting paid. Yet, these individuals are figuring out how to bilk millions of dollars. It shows the system is completely messed up. According to this article by News 3, Dubin and other co-conspirators applied the allografts to patients without regards to medical necessity. According to the allegations, they included applying them to infected wounds that were not responding to treatment, and in quantities that exceeded the size of wounds. So I believe they might have been able to bill per size of it. So if it was a procedure that, let's say, only needed like a 2x2, a 2 centimeter by 2 centimeter, or a 5 centimeter by 5 centimeter. But basically, an allograft is a tissue or a piece of an organ or a cell line that you can, as opposed to like an autograft, your own grafting. An allograft is from one person to another. You could use it from a cadaver. You could use it from a human donor, but it's another tissue. It's a tissue from another body part, from another individual, that can be used to help you heal. So let's say somebody has severe burns and they've lost a lot of surface area of their skin. We may try to do an autograft and use some of your own your own skin from your butt or another part of the body that didn't get hurt. But if you're injured and you're sick and you're not able to tolerate the procedure, or you have poor skin, we're going to want to use healthy skin from a donor. And so we use allografts for bones and skin and ligaments and all sorts of different things. So it's a very, very common process. It's just allegedly this Dr. Dubin and his co-conspirators evaded the medical necessity, took advantage from what we understand. And then they say that he funded a lavish lifestyle with multi-million-dollar yachts for himself. And the indictment charges him with conspiracy to commit healthcare fraud and 5 counts of healthcare fraud. If convicted, he faces up to 10 years of prison for each count. I was listening to J.D. Vance today speak about the fraud. He said what surprised him was that many cases of fraud weren't even prosecuted. Cases that amounted to $1 million, where there were thresholds where the government said, we're not even going to pursue it. Now, he has announced that they've identified $230 billion in federal program fraud. They prevented $56 billion going out on improper payments. He is urging Congress to pass new oversight legislation. He says some Democratic governors are working with him, but a big concern they have is when they do SNAP benefits or Medicare and Medicaid benefits, that the states are not being transparent. And if a state does not want to be, once the money goes to the state, the government doesn't get to see it or know what's going on. And so it could happen to like what we saw in Minnesota with the Somali fraud scheme that happened with some Somali residents and immigrants. So J.D. Vance wants there to be laws saying if you're going to be getting government money, there has to be transparency on where the money goes. I'm surprised that there has to be a law for that. That should already be commonplace. I mean, that's just, it's, you know, I don't run a nonprofit, but if you run a nonprofit, if you get money into that nonprofit, you have to be very transparent of where the money goes. I think you could use up to 35% for administrative costs for your phone bill and your electricity bill and your rent and your salaries and stuff. But the rest of it, the 65% at least, you need to show, where that's going to. There has to be transparency. And so this is a huge watershed moment in terms of fraud. I worry that after the Trump administration, if it's going to go back the other way, this gravy train has, really been so chaotic and allowed politicians and many people to take advantage. But Vance wants reforms. He does need a little bit more money, he says. Even though they're saving taxpayer money, they're involving so many task forces and so many government agencies that it is involving resources, and they do need funds to continue to pursue this, which I completely understand. But like he said the federal government distributes money to states for the Supplemental Nutrition Assistance Program, SNAP, and the federal government has no visibility into who is ultimately getting those benefits. He said if California provides those food stamp benefits to an illegal alien, to a violent criminal, the federal government has no visibility, and sometimes the states themselves have no visibility. He says, so we need to work with Congress, and we need some legislation that would actually force some data sharing between state governments and the federal governments. I agree with that. I think that is completely justifiable and valid. I don't know what the Democrats are going to do, but they better do something. 1-877-Doc-Dolly.
This is an urgent announcement for anyone that's $10,000 or more in debt. Before you make another minimum payment, you need to know there are special programs that can completely free you of your debt. Total Financial Freedom can help you become debt-free in months instead of years. Resolve your credit card debt, signature loans, department store cards, internet loans, and timeshares. Call Total Financial Freedom now at 800-878-6020 for a free consultation. For 16 years, Total Financial Freedom has helped thousands get out of debt. You can feel confident when calling because Total Financial Freedom is A+ rated by the Better Business Bureau. Battling for years and years stuck in the endless cycle of minimum payments could take decades. You have the right to get your debt resolved and substantially reduce your monthly payments. Call Total Financial Freedom now at 800-878-6020. That's 800-878-6020. 800-878-6020.
Let's face it, guys. We're living in times where the truth is becoming more suppressed and censorship is increasing at an alarming rate, especially on social media platforms. It's Clyde, and I want to tell you about a safe and secure digital playground we put together just for you. It's Aftermath.media. You get access to thousands of Ground Zero archives and podcasts, along with our private social media groups with your basic membership starting at only $7 a month. Each subscription includes tech support, access to the RSS feeds, along with our own chat room and Telegram channel. In addition, the premium membership includes research study groups, webinars, a document and movie library, a live video stream of Ground Zero, a monthly Zoom chat with me, and other bonus content. Be sure to check out our yearly specials as well. Sign up today while you're thinking about it. Sign up at Aftermath.media. Again, that's Aftermath.media.
back on the Dr. Dahlia Show, 1-877-DOC-DALI, 1-877-DOC-DALI. Big thanks to Talk Media Network for making the show happen. Big thanks to Daniel, our producer, and big thanks to y'all for tuning in. We really do appreciate it. Don't forget to follow us on Twitter or X at Dr. Dahlia, Facebook, The Dr. Dahlia Show, and on YouTube, click like and subscribe. So, with the back and forth between biological men and women's sports, would a matchup like Clay Travis from Outkick had suggested, would a matchup of a boy team and a girl team put the discussion to rest? And he's not even asking for men's NBA to go up against the WNBA or a college team like Duke to go up against the WNBA. Clay Travis is suggesting and has put $10 million on the line for the Las Vegas Aces, who I'm pretty proud of, good team out of my neck of the woods, to play a high school boys team. And no matter who wins, we'll get the $10 million. Either the WNBA team will get his $10 million, or the high school basketball team will get the $10 million. Now, I know a lot of people are thinking, okay, well, this is just Clay Travis's way of getting some attention and all that, but we keep going back and forth with what is legitimate in sports, what sidelines women. Are we hurting women's progress by forcing them to lose against a biological male and affecting their private spaces and privacy, which is something that women have long tried to fight for? In sports, it was all about women's sport. It was fascinating how the Democrats were so in support of women's sports and women and safe spaces and all that. And then all of a sudden, now that the subject came up with biological males identifying as women, now the Democrats are split, going, well, wait a second. Now they don't know what to support. And I'm frustrated that they're really starting to beat up our players about this. Okay, I don't want our Olympic medalists and our Olympic athletes and our WNBA players and our football players and our basketball players and our high school players. I don't want individuals being consistently harassed by reporters to take a political side. And this is what we're seeing. Caitlin Clark was asked. Caitlin Clark, the Indiana Fever, I believe, just lost to the Minnesota Lynx a few days back. So what was she asked about? The Save Women's Sports movement. And she was asked about the controversy because there's demonstrations going outside the Indiana Fever games when her teammate Sophie Cunningham voiced her support for protecting women's sports from biological males back in July. Rallies in support of Cunningham have followed the Fever to their last 3 games, and there's also been counter-protests. Well, Caitlin Clark doesn't want to talk about that. They just lost the game. And so when she was asked by a reporter, she said, I think for us, it's not really a discussion we really have in our locker room. She says, I think it's for the leagues and the governing bodies to work with their athletes to find solutions. Our focus is on basketball. That's what we talk about and how we can get wins. And obviously we didn't do that tonight, so we need to find an area to improve in that way. I guess she was then hit with another follow-up question, and she said, I just answered for you. So these, making people pick a side, get political, it's really distracting. You want your athletes to focus on athletics. Just because the media and just because some politicians are all about politics doesn't mean the rest of us have to. Now, I'm trying to warn medical students about this too. Don't let your patients distract you with politics. Your job is to take care of every patient, no matter their creed, their color, their race, their belief. Don't be getting into these political discussions. If you like politics and that's something you want to do, that's one thing. But don't get distracted. Don't get biased. Don't get angry. Your job is to focus on the patient. These players' jobs are to focus on the sport. Well, so Clay Travis comes up with an idea where, and I know some people think it's gimmicky, but this is interesting. I don't think it'll work. And I don't think the WNBA is going to act on it. But it is interesting where, he gives $1 million to whoever wins the game, WNBA or boys high school. Now, like the Las Vegas Aces, I mean, their height can range anywhere from 5'9" to 6'5", 175 pounds on average. Whereas, a high school boys team, some of these boys don't reach their full height until they're 18, 19. So, some of the boys could be shorter. Some of the boys might not be in the 200-pound range. So there could be a little bit more of a playing field if you take a full-grown woman on the WNBA and compete them in a pubertal male on a high school basketball team. And I'm assuming he's choosing varsity, so many of them have already gone through a good part of their puberty. To try to compare a male and female biologically in a game. I still think if you put them up against a high school male team, I think the WNBA would win because they've been playing longer. They're more seasoned. They have the experience. And so I think with the biological advantage that a high school male could have, if again they haven't reached their full height or capabilities, if you're trying to make a point that biological males without any restrictions can interfere with female sports, then to kind of hinder or to affect the sample size, I don't know if that would be the most equitable. I would like to see a WNBA against a college team. I think you would definitely see the differences, and it would be pretty apparent. The WNBA is not going to go for this because interestingly, they shouldn't. If I was advising the WNBA from a marketing standpoint, from my PR background, I would say not to, because them losing to men would not be a good look. The WNBA is already struggling in terms of ticket sales, in terms of getting people interested, because people really like watching male in sports. They've been struggling watching female in sports. And so some things that they've tried to grasp onto is controversy, is some notoriety of some of the players, some of the fights, the looks, trying to have attractive players. I mean, they've been trying to find, and they're gaining, especially in my neck of the woods. The Las Vegas Aces are pretty damn good. I mean, it's a fun game to watch. They're good. They play some damn good basketball. Women can play, but that will ruin it for people if they see them not be able to beat men. And it's I don't think it would help the WNBA. I think it would help the controversy. I think somebody has to be really, really honest. I understand. I think it was the Minnesota Lynx coach that wore a shirt saying trans kids. I forget what her shirt said, that they should have access to sports. Any child should have access to sports. But the biological males should be playing with the biological males, and the biological females should play with the biological females. It's the fact that we're having this conversation, and 80 to 90% of the country agrees with this, but it's being used as a distraction. This is so that people are not aware of the mess Biden did or other things going on. People are trying to use this as a distraction. And I don't like that, especially when it comes to sports. And sports is supposed to be our escape. But seeing a biological high school male compete against a biological female, we've seen videos of what happens. These women are getting hurt. If you try to step up and use a female adult against a high school boy, that would be interesting to watch, but again, somebody with the experience could still outmaneuver them, probably outshoot them, and then also, will the boys be concerned about tackling? Remember, these boys might have never played against a female, and having a female, and they're afraid to accidentally touch something, I mean, if you watch the contact between these basketball players, they contact each other a lot. They are all up in their business. And now they have a female with boobies. They're going to act different. They're going to play different. And so I don't think it would be a true test. But seeing a college team against a WNBA might be more of a truer test. 1-877 Dr. Dolly. Dr. Dahlia here. Are you tired, burned out, gaining weight, succumbing to the daily pressures of life? Well, how's your dopamine doing? How you feel right now, how you'll feel an hour from now, and how you'll feel next week is completely reliant on your dopamine. Our daily motivation and willingness to push through challenges depends on the intricate chemical process dopamine provides. Christian Kalikas and I created Deploying Dopamine, a book that tells you what dopamine is, when it dysfunctions, and how to successfully deploy it when needed. Find Deploying Dopamine on Amazon today. Check it out.
At Hotshot Secret, we share the science behind common diesel problems. For example,
Diesel fuel cetane levels.
the cetane rating in diesel fuel is 42 to 45. Most diesel engines operate more efficiently with a cetane rating of 48 to 50. One treatment of Hotshot Secret Diesel Extreme will raise your cetane 7 points, increase fuel economy, and improve cold starts.
Hot Shot Secret Diesel Extreme is available nationwide at truck stops, fine farm and auto stores, and online at hotshotsecret.com.
Hot Shot Secret. Powered by science.
And we're back on the Dr. Dahlia Show. Thank you all for tuning in. I thought Chipotle was going to be out of the news for a little bit, but they're back in the news. Poor Chipotle. I'm a big fan of Chipotle. But when we were talking about foodborne illnesses, Chipotle seems to kind of keep getting beat up on because they offer fresh ingredients. Well, whenever you offer fresh ingredients, you sometimes can have a higher risk of being at risk of, non-preservatives fighting off some of these bacteria. And so Chipotle has had to pull its jalapenos from its menus in the U.S. Food chain said in a statement that they have proactively removed jalapenos from their restaurants as public health officials are investigating a source of a salmonella outbreak. The announcement came after Bloomberg News reported that Chipotle had removed jalapenos from multiple stores in Minnesota. Apparently, there's a salmonella outbreak in the state that has sickened over 110 people. They say Chipotle's move, according to, HuffPost, they say Chipotle's move comes on the heels of 2 people in Michigan dying from the Cyclospora outbreak. Chipotle is not related, as we know, to the Cyclospora outbreak, but being what happened with that and the recalls that have been done, including Taco Bell's lettuce, they're not taking any chance. Now, salmonella is different from the parasite Cyclospora. It's a bacteria. Many individuals will be able to many salmonella infections may self-limit, but sometimes you do need antibiotics. Chipotle said in a statement, "We are aware that public health authorities are investigating the source of a salmonella outbreak in the supply chain, impacting several food service retailers. We're cooperating with the public health authorities in their efforts. Out of an abundance of caution, we proactively remove the jalapenos from our restaurants and replace them with product from different growers." It does not mean Chipotle's jalapenos are the source of anything, but they are playing it safe. The Cyclosporus cayetanensis outbreak now has reached over 12,225 reported to the CDC. There are, I believe, 20,000 now unreported or non-documented or confirmed cases. And the investigation by the FDA linked one of the outbreaks to iceberg lettuce served at Taco Bell restaurants, sourced from privately held Taylor Farms operations in central Mexico. Walmart and Cisco have joined Taco Bell in removing potentially affected lettuce. Also, I guess the nation's largest food distributor has halted Mexican lettuce purchases. Cisco will stop buying iceberg lettuce from Mexico as federal health officials are investigating this outbreak. Now, this has been reported by Fox Business. The announcement from Cisco CEO Kevin Hurricane comes as the FDA and the Centers of CDC investigate the outbreak after there have been 2 deaths reported in Michigan. Those individuals did have other medical conditions, but still, because they had cyclospora, we cannot say cyclospora is completely benign. It can cause hospitalizations, as we have seen, and it can cause death. Now, the outbreak, as I said before, was linked to iceberg lettuce sourced from central Mexico through Taylor Farms de Mexico. Taylor Farms U.S. businesses voluntarily recalled certain iceberg lettuce products sold under the Taylor Fresh Foods and Market Side brands. The company has maintained that the FDA has still not identified a confirmed positive test for cyclospora. Remember, there was a false positive test, but out of precaution, they still allowed their distributors to initiate recalls. As you know, cyclosporiasis is an intestinal illness, not a bacteria, but it's caused by the parasite Cyclospora cayetanensis. And we can actually use an antibiotic such as Bactrim. Even, I believe, zithromycin can be effective at preventing its replication and folic acid metabolism. The sulfa works that way. The sulfa drug like Bactrim. According to the CDC, the infection causes watery, often explosive diarrhea that could last for weeks or even months if untreated. Other symptoms include abdominal cramping, bloating, nausea, fatigue, and significant weight loss. You have some idiots on TikTok saying they want to lose weight and get it on purpose. Please do not get this on purpose. All right, not good. 1-877-DOC-DOLLY, 1-877-DOC-DALI. So this is a scary case. A Georgia woman is suing because she had an unnecessary hysterectomy after the lab mixed up her results and cancer misdiagnosis. She comes from Atlanta, and she says there was a negligent handling of a tissue sample that led her to be misdiagnosed with an aggressive form of uterine cancer. She underwent a full hysterectomy when she was 43. Forced into premature menopause, doctors removed her cervix, uterus, fallopian tubes, ovaries last year. And it's against Kaiser Foundation Health Plan of Georgia, Kaiser Foundation Health Plan, and Kaiser Permanente Insurance Company. The lab technicians also being sued, the ones who handled Cassandra Barksdale's sample. She went to her doctor at a Kaiser Permanente Center in January 2025, had abnormal uterine bleeding and uterine fibroids. The lawsuit says she was referred for a consultation, according to NBC News, and had an endometrial tissue biopsy on March 2025. The tissue was submitted to Quest Diagnostics for pathology. She was told on March 17th that she had a high-grade aggressive endometrial uterine cancer. She had a CT scan, but the suit says there was no signs of cancer. So she was sent to a doctor at Northside Hospital, Atlanta. Barksdale, new doctor, recommended a total hysterectomy, the removal of her ovaries, lymph node biopsies based on her previous imaging records and path reports. But testing the tissue after her surgery, which is what they do, to see how, they'll take the uterus and the lining and they'll test it. There was no signs of cancer in the entire endometrial cavity, which means somebody screwed up and mixed her results up. Now, this is tricky. Right? And it's horrific that this happened. She's seeking at least $10,000 in damages in a jury trial. This should have never happened. But somebody could say, why didn't the doctor just redo the test? Why didn't the doctor just, if the CT looked negative, why don't redo the biopsy? The probability of a biopsy being wrong, especially showing high grade, is so rare that let's say you decide, I'm just going to, for poops and giggles, going to redo the test, which insurance companies don't really let you do. We used to do tests 2-3 times. They don't let us do that anymore. You have the test. You need to justify why you're doing it a second time. And if you say, well, I think the lab is messing up, that, as much as I would think that, because I've seen labs mess up, that most insurance won't. They'll make the patient pay for it. But let's say you do a biopsy. Let's say you do an endometrial biopsy, which is where you put a little pipette into the uterus, and then you suck out some of the lining, and then you plunge it into a vial and send it to the lab. Let's say that comes out negative. Well, now you have a woman who has 2 tests, one that says negative biopsy and one that says a very highly aggressive cancer. Now, one thing they might have been able to do is take her in for a procedure and do a more thorough scraping. But if you're going to already scrape everything off, and it's a woman who might not be having kids anymore, they might have suggested, do you want to just get this removed? And so it's bad that this happened, because if she had a normal normal biopsy, she might have never underwent having a hysterectomy. Now, I'm very glad I had my hysterectomy, but some women who have hysterectomies, everything's different. Their bladder control, sex, their body image. So there's, it's not very easy for somebody to get a hysterectomy. For some of us, we love it, but others, no, they might not love it. And they have every right, and she has every right to, be concerned and complain. But with something like this, we've heard of babies getting swapped, right? Right. We have those two men who an ancestry and meat test clued them in that they might not be related to their or to their parents who they thought were their biological parents. Lab errors happen, and I don't know why. And it's frightening to think that happens. And when I, ran my office and I, would get a lab test back, I always tried to confirm to the best of my abilities. And there's only so much you could do. You can't micromanage everything. You have to rely on a lab to do their part. And for something like this to happen, now, some of these other doctors might say, look, this was the lab result. I had to go with that. But a lawyer can still say, look, we're going to sue because you should have double checked. That's one of the reasons why I had an x-ray machine in my office. I didn't want to just believe what the radiologist said. I wanted to look at the x-ray myself because that's how I was trained. But am I able to look at the pathology myself? No. If I don't have a lab, I can't do that. 1-877-DOC-DOLLY.
Carl Amari here to tell you about our newest website for old-time radio lovers. It's 100radioshows.com. At this site, there are 5 old-time radio shows waiting for you to download free as our gift to you, and be sure to browse the additional 700 old-time radio shows available to you for 70% off by using the promo code RADIO at checkout. This is a limited-time offer, so log on to 100radioshows.com. That's 100radioshows.com.
Have you ever thought you'd like to buy and sell houses but didn't know how or where to get the money? My name is Ron LeGrand, and over the past 40 years, I've bought over 3,000 houses without using my money or credit and taught thousands to do the same. Today, even in a virtual environment, we buy nice houses in nice neighborhoods using no banks, realtors, contractors, or other costly entanglements, and build huge cash flow and wealth without the hassle of tenants, all without credit and little or no money. You don't need a license or experience, and I'll show you exactly how it's done. Text FREE to 99799, and I'll send you my free training. I promise you I'll change the way you think about real estate and open the door to a new lifestyle that doesn't involve risk or rehabs and can quickly replace your current income. Text FREE to 99799, and let me show you how to take your life back and build cash flow and wealth from your home. That's FREE to 99799. Again, FREE to 99799.
Hi, everyone. Dr. Dahlia here. Thousands of physicians, residents, nurses, and medical students are silently dealing with depression. And tragically, 400 take their lives each year. 400! I wrote The Depressed Doctor, hoping to reach out to anyone struggling. You're not alone. Don't stay silent. The Depressed Doctor can be found on Amazon, or the book can be found on drdahlia.com. And if you or anyone you know needs help, call or text 988, the National Suicide and Crisis Hotline. And we're back on the Dr. Dahlia Show. So while we're waiting for our next guest, this new study that came out earlier this week has revealed that Americans are using marijuana more than drinking alcohol, more than smoking cigarettes. Some people think this is a good thing. Some people think this is a bad thing. The rise in cannabis has been always there, but now that people feel more comfortable because of the legalization, I think we're having more people admit it. And so whereas patients used to say, oh, I don't use marijuana, and I'm like, really? And they're like, oh, yeah, I do. Now people are very open about it because they, back in COVID, remember, you couldn't go to the dentist. You couldn't go to a restaurant. You had trouble walking into a pharmacy without showing your papers and your mask, but you could go into a cannabis dispensary. So, yes, obviously, cannabis use has grown and has become very, very popular. The Substance Abuse and Mental Health Services Administration released data from the 2025 National Survey on Drug Use and Health last week, showing 21.4 million Americans are using marijuana daily or almost every day. The figure overtook daily cigarette smokers, which is about 20 million, and those who consume alcohol daily, 17.2 million. Overall, SAMHSA found that 43.8 million Americans used cannabis on a regular basis. 36.1 million smoke cigarettes regularly. That's 1 in 8. I'm going to want to talk a little bit about this more later this week, but using marijuana daily, are they using it for sleep? Are they using it for anxiety? Are they using it for pain? As a doctor, I need to know why people feel that need to use it daily. With cigarettes, okay, you could be addicted to nicotine. With alcohol, are you addicted to alcohol? Looking at what, 20 million people, smoking now still daily, almost 20 million using alcohol daily. That needs to be addressed because that's hurting people. But why is marijuana surpassing that? Is it that people think it's healthy? Is it that they're becoming addicted as well? Is the marijuana withdrawal that we're starting to hear many stars like Sharon Stone say the marijuana withdrawal was so bad that they, tried to avoid, that they had to get that treated? So we might be, making great movement on the smoking cessation programs and all that, but we pivoted people to food, and that's why we have an obesity crisis. Now that we're using Ozempic and these other medications, people are pivoting to something else. People are very addictive in nature. That's their dopaminergic and impulsive bio makeup to do something on a regular basis habitually. And marijuana is not safe long term. It's causing a lot of issues, depression, anxiety, not to mention, if this is something that I voted to legalize because I wanted to see medicinal applications for pain and anxiety and other things, insulin resistance and sensitivity. If we blow it and are overusing it, then we're not going to be able to utilize it for the medical applications that we might need in the future. So coming up, I want to switch gears to talk about back pain and our next guest. This is a very, very interesting condition that's rare that we're going to learn a lot of. So we're going to be switching gears in just a second. And here we go. So August is SMA Awareness Month. SMA stands for Spinal Muscular Atrophy. And I am very, very grateful for our next guest. Spinal muscular atrophy is a genetic disease that disrupts how the body supports healthy muscle function. It ultimately can lead to progressive and debilitating muscle weakness. So it's extremely critical to diagnose this early on. And we've struggled, over, the last century coming up with achievements. But lately, we have been able to make huge advancements in the SMA treatment space, including disease-modifying therapies or DMTs. Now, these treatments target the underlying biology or root scientific cause of the progressive disease versus just managing the symptoms. And we, in medicine would rather get to the root of it. So this can actually help create a fundamental change that can slow disease progression or reduce its severity. I am really excited for our next guest, Dr. Manisha Korb, neuromuscular specialist at Palm Beach Neurology, who is going to discuss the SMA patient experience and how advancements are helping. Dr. Korb, thank you so much for joining us.
Thanks so much for having me here today. I'm excited to be here partnering with Genentech to help raise awareness about spinal muscular atrophy as a paid spokesperson.
For those who aren't familiar, what exactly is spinal muscular atrophy or SMA? And talk to us about how it's diagnosed.
Spinal muscular atrophy, or SMA, is a rare genetic condition that causes a loss of a protein in the body that is used to support the health of muscles in the body. And so that can look different from person to person depending on the age of onset of symptoms and the type of mutation that a person is born with. So for infants, they may have very severe difficulty with breathing and swallowing and meeting their motor milestones, such as sitting, crawling, standing, or walking. And for those who it presents later in life, where it's in childhood or adolescence, they may achieve those motor milestones, but they may lose the ability to do them over time, where they get weaker and weaker and may revert from walking to having to use a wheelchair later in life. Now, it's diagnosed with a simple genetic blood test, and that can be done with your doctor's office. It's also available in prenatal screening and newborn screening.
How does SMA specifically impact a person's daily routine and their overall sense of independence?
Yes, so depending on the age of onset and the type of gene mutation severity that they may have trouble with simple tasks such as breathing and swallowing in the more severe cases. But in milder cases, they may be okay with those. Those parts may be preserved, but they may have trouble using their hands, using their legs. So, for example, getting dressed in the morning or preparing food or driving, those things may be impaired. But one thing I want to mention it doesn't do is it does not affect your ability to think or to learn or to have meaningful relationships.
The treatment landscape has evolved over the years in how we treat rare diseases, especially SMA. Can you tell us about Evrysdi? What are some of the considerations you have when recommending this medication to your patients?
For a long time, the only methods we had to treat SMA were with supportive therapies, things like physical therapy and ambulatory assisted devices, which still play a major role in how we manage SMA now. But in the last 10 years, there have been massive leaps in the space of disease-modifying therapies. So those are therapies that are treating the root cause of the gene mutation and helping change the overall course of the disease. The one I want to highlight today is called Evrysdi, also called risdiplam. This is the first orally administered medication that is FDA approved, and it's for all ages of SMA, infants, children, and adults. It works by restoring that protein that's deficient and helping the muscles sustain their function over time and slowing down disease, stabilizing it, and in some cases even allowing the person to get stronger and meet motor milestones. But with all medications, we have to think about side effects. In adults, the most common side effects are fever, diarrhea, and rash. But as this is an oral medication, it can provide a more consistent and daily routine for patients who are looking for something that allows them to have that flexibility.
For our viewers who might be navigating an SMA diagnosis in their own family, what is the most important piece of advice or help you can share with them today?
Well, SMA is something that someone is born with and carries as a lifelong condition. It doesn't have to limit them or define them in everything that they do and everything that they want to achieve. I've seen many patients with SMA who are able to achieve advanced degrees, become doctors, lawyers, or business owners, and they can have meaningful relationships and their own families. So if they have access to a disease-modifying therapy, they can, again, change the overall course of their disease and hopefully prevent that overall progression, slow things down, and maybe even get stronger, sustain those motor functions for longer.
Dr. Korb, this has been amazing. I'm so glad you've been here. Thank you for enlightening us with this. Where can our viewers go to learn more about SMA and Evrysdi?
So I encourage people to visit evrysdi.com for more information and talk to their healthcare providers.
All right, everybody, don't go away. We'll be right back. 1-877 Dr. Dolly.
Can you believe, with all the recent violent protests, looting, and destruction, some areas are considering either defunding or abolishing the police? At a time when America's neighborhoods need the protection of police the most, some elected officials would rather create more chaos by playing politics. If you're sick of elected officials caving in to demands of the radical left, you're not alone. It's time we stand up and declare our support for local police. The majority of police officers are important partners in protecting our God-given rights. If you prefer freedom over chaos, then learn how you can help protect the local police that serve your community. Call today and request your free Support Your Local Police info packet. Dial 800-JBS-USA-1. That's 800-JBS-USA-1. Request your free Support Your Local Police info packet by calling 800-JBS-USA-1 today.